Hi, my name is Faith Whithoft, and this is my SDG 1 assignment. We'll be talking about Sustainable Development Goal number 3, which is quality health and well-being, and the country I chose was Italy. So we'll start by talking about what SDG 3 is. Well, SDG 3 seeks to promote well-being and healthy lives for people all over the world in a variety of different ways to tackle a variety of different issues such as maternal and child health, communicable diseases, substance abuse, universal healthcare coverage, etc. And now we can go over specifically in Italy, what are some of their healthcare challenges that they're facing and statistics that give us an overview. So, a life expectancy of 83.7 years is the average. The child mortality rate is low at 0.28. The Universal Health Coverage Index, which goes from 0 being the worst to 100 being the best, sits at an 80. And the child mortality ratio, or maternal mortality ratio rather, which is deaths per 100,000 live births, sits at 4.59. To compare, here's the USA. We can immediately notice almost a 4-year difference in the life expectancy average, a child mortality rate of 0.65, which is almost triple that of Italy, the same UHC index number, and maternal mortality ratio is what gets me, which is at 21.1, which is about 5 times that of Italy. And why is that? So, for the United States, the American healthcare system is a public private hybrid. You can hardly call it a system where receiving healthcare often relies on your employment or personal finances, and sometimes the government will fund it for you depending on your specific circumstances, being Medicaid and Medicare. Now, in Italy, the Italian healthcare system is a universal, publicly funded system where there is no large out of pocket cost for residents. Now, that does mean less access to specialist and cutting edge treatments, but an overall lower financial risk, and healthcare becomes more available to those who need it. And in the USA, it's a higher financial risk, but there is more access to specialists and new cutting edge treatments. Now, this makes sense to me as to why the USA is facing a lower average life expectancy and higher death rate, both child and maternal mortality, because there's just less universal access to this healthcare. Whereas in Italy, they're doing a good job to make this available to everyone. And despite that, there are ways that they can make it better. So we're going to go over a few here. In Italy, using global information technology to support SDG 3, we can go into some advanced analytics and AI, implementing more AI driven applications to assist doctors in concise and accurate diagnoses for patients. And using telemedicine and remote care, we can utilize these capabilities to create more accessibility and reduce unneeded hospital visits for patients. And expanding telemedicine remote care to promote or to poor or distressed areas to provide quality care regardless of where a patient resides. Even if they're in a distressed area, they're able to get the care that they need. And this reduces unnecessary delays in patient care and can really lower the overall death rate and heighten that life expectancy that we talked about. And the one that I find very interesting, working with an electronic health record myself, I work with Epic. I think there's a lot of things that I see daily that we can do better with it. And in Italy specifically, by enhancing EHR analytics and other capabilities, we can support patient care, of course. Improving the quality of patient health summaries. So, a whole summary of this patient's health to provide doctors with critical health data. If that patient comes into the emergency room, the doctor needs to know, what health issues does this patient have? How can we best tackle this? And what could be causing their current health emergency that they're coming in for? And this would help in diagnosing and treating them in the most quick and accurate way possible, and just improving the electronic health record sharing between different networks. I think this is something that's so important so that all patient care data is available without hassle. Epic electronic health system has something called Care Everywhere, where you are able to allow your care summaries and documentation of your care with other doctors to be shared with any provider that you see, within certain limits. But I think this is so important so that one doctor doesn't use one EHR and then another doctor uses another one, and then there's critical health data that's lacking somewhere, because that can be the difference between life and death, and that can really help, especially here in Italy. Here are my citations and references for the presentation. Thank you.